Hi, my name's Sean, and I'm going to be talking about gram staining and its application in brightfield microscopy for the identification and visualization of bacteria. Bacteria are categorized into two main groups: gram-positive bacteria, which are visualized under the microscope as purple, and gram-negative bacteria, which are visualized as pink. Bacteria are exceptionally small, on the orders of 10 microns, tens of microns. So you need a microscope to visualize it. Once you visualize your bacteria under the microscope and confirm whether it's gram-positive or gram-negative, you can do a set of pre-described tests to further identify your bacteria to the genus and species level. So we're talking E. coli, Staphylococcus aureus, Streptococcus pneumoniae, so on and so forth. This is particularly useful in the medical diagnostic application field. A patient will sometimes present with signs and symptoms of a bacterial infection, but the care provider may not be convinced that it truly is bacterial. It could be idiopathic, caused by the immune system attacking itself. It could be viral. It could be many other things besides bacterial. A timely and accurate gram stain first confirms for the care provider that bacteria is present in the suspected infection. Second, with a gram stain result, the diagnostic technician can do tests to hopefully identify the bacteria to its genus and species level. Once the genus and species level can be reported out, the care provider can prescribe an appropriate antibiotic for the infection. A timely and fast, accurate antibiotic prescription can decrease hospital stay, recovery time, and in the most serious of cases, mortality, such as blood infections and CSF infections. So how does gram staining work? It's comprised of several sequential steps of different stains and washes. The first step is the addition of crystal violet dye, which is a water-soluble net negative dye. The crystal violet penetrates into the bacterial cell wall, which contains peptidoglycan. If you look to the top right of this slide, you'll see graphics of gram-positive cell wall. You'll see a graphic of a gram-positive cell wall and a graphic of a gram-negative cell wall. The gram-positive cell wall has a very thick peptidoglycan structure, which is comprised of different acids linked together in a lattice structure. The gram-negative cell wall has a very thin peptidoglycan wall. Once the crystal violet penetrates into the peptidoglycan wall, liquid iodine is added to this stain, to the slide with the specimen. The iodine has a net negative charge, which interacts with the crystal violet to form a crystal aggregate. The next step in gram staining is an alcohol wash. The alcohol wash dehydrates the bacterial cell, which pulls water out of the cell. In a gram-positive bacteria, the crystal violet iodine aggregate is stuck within the peptidoglycan lattice structure, whereas in the gram-negative cell wall, the dehydrating water evacuation from the cell pulls this crystal violet iodine aggregate out. The next and final step of gram staining is the addition of a saffron counterstain. When saffron is added to a gram-positive bacteria, a little bit of the dye enters into the peptidoglycan and cell, but the cell is already saturated for the most part with the crystal violet. So when you visualize a gram-positive bacteria after this counterstaining, you still will visualize it as being purple. Whereas the gram-negative bacteria had the crystal violet pulled out with the alcohol dehydration. So when the counterstain of saffron is added, saffron will penetrate the peptidoglycan and the cell, and then subsequently be visualized as pink. So how does this relate to microscopy? Well, bacteria are exceptionally small. You cannot see them with the naked eye. They're in the order of tens of microns. So you need magnification from your microscope through the refraction using lenses. A typical visualization of bacteria requires about 10,000 times magnification. So 10x magnification through your lens, or through your ocular lens, and then 100x magnification through your objective lens. Secondly, the staining of bacteria transforms it into an amplitudal object. Before bacteria are stained, they are considered a phase object, where light passes through the bacteria, through the lipid bilayer membrane and the different water constituents and whatnot of the bacteria, and it slows down the light, but it does not change the brightness of the light. And our eyes cannot visually detect a phase shift. When you add the dye to the bacteria, this causes the amplitude of the light, of the white light traveling through it, to change in the different spectrums of the light. The different colors of the light will decrease in amplitude, which is brightness, differentially. So for gram-positive bacteria, the blue light will be the amplitude of blue light will be least affected compared to the rest of the spectrum, which then through our visualization will be perceived as staining blue. So, in conclusion, gram staining is particularly powerful in the medical field for the fast and accurate visualization and identification of bacteria. And gram staining in the realm of microscopy is intended to transform bacteria into an amplitudal object to see different colors. And also, we are able to visualize bacteria with magnification. Thank you.